to our cloud site, and everybody can go back and rewatch it at their leisure, or you can share with your colleagues that it will be posted later if they weren't able to attend today. That'll be available on kh.org/caregiverwellbeing. All right, with that, I'll turn it over to Dr. Peterson to introduce today's speakers.
Yes, I'm really excited. We have a extremely knowledgeable panel of speakers today to give us some education about social determinants of health, which are critical to all aspects of healthcare and are kind of a newer topic and a growing topic of conversation in healthcare. And I think we've all seen it down in the lower left corner of Epic and may not have an idea of what that's referring to. So we have the panel today, so thank you. First on the list, we have Don Duffy, who is the District Director for Panhandle Health District. We're very fortunate to have him joining us today. Mr. Duffy, I'll turn it over to you.
All right, thank you so much, Doctor, and thank you, Elizabeth, for putting this together for all of us. I do have some things to share, but I'm really excited to hear from Laura and Jill as well today. So I'm going to go ahead and share my screen, and let's hope that this works for all of us here. And hang on here. Make sure I've got this up. I did a moment ago. Okay. Try this again. Hang on here, folks. I have this all set up and good to go.
It's all right, Don. We learned a lot through the pandemic. This is just one of those things.
Not a problem.
For some reason, it's not showing up on my screen here. Hang on one sec.
No problem. Do you want to share about our other upcoming speakers as well? We can introduce them now.
Yeah, so after Don, we have Laura Bonneville joining us from Heritage Health. She's a behavioral health consultant, and Jill Weeks will be joining us from our very own Kootenai Health. She is the Executive Director of Transitional Care Services. And it looks like Don has got the technical issues worked out, so
yeah, you would think after 2.5 years of this would be a easy process, but here we are.
So I am excited.
I'm excited to talk to all of you a little bit about social determinants of health. And my task today with all of you is to really give you an overview. And I hope it's not a little too remedial for all of us, but this is such a broad and wide topic. I think it's helpful to kind of talk about it foundationally of what it means when we say social determinants of health. And as you can see in my presentation today, the definition is simply conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. And this is an interesting topic when we look at North Idaho and the people that live in the community that we serve. And I'll explain that a little bit further as I go forward. And what you'll see, and you actually, this was on the initial slide, that the welcome slide that Elizabeth had given us. These five domains, if you will, associated with the social determinants of health. And I'm just, I don't have these in really any order of importance because each one is important for all of us. So going forward here, the first is healthcare access and quality. And that's simply defined as the connection between people's access to and understanding of health services and their own health. Key issues include access to health care, including primary care, health insurance coverage, and health literacy. And that's an interesting and changing topic for us here in this community. Health access, at one point, it was just getting in to see the doctor and you didn't have insurance, and it was challenging. And now we have a Medicaid expansion here in our state where everyone, almost everyone, has the ability to be covered under health insurance. And we've seen at Panhandle Health District that this has created, although a wonderful advancement here in our state, this has created challenges as well. We have people that have insurance, but simply are not finding a physician or inability to get into a physician. I know of one incident here in our health district where we have a very, very talented RN who has Blue Cross of Idaho and some very, very good coverage. But still, her physician continues to be the emergency room, and if she's lucky, an emergency care center, because she cannot find a physician that will take her as a patient. So one of the challenges, of the many challenges that we face regarding healthcare access and quality. I was at a meeting here last week with the Idaho Association of Counties, and they were talking about emergency medical service access to patients, where patients are choosing to live in locations where EMS is at least an hour away if they were to have a medical emergency. And that's part of why people like to live in Idaho, not that they don't want EMS services, but they're wanting to live in very rural settings, some so much that they want to be off the grid. And how does that affect healthcare access? It seems like they're making decisions not to have great access. Some of the issues that we face. Our goal here, that we might just a very broad goal, is to increase access to comprehensive and high quality healthcare services. And that is no easy task for us. From a health district director perspective, I wish we had more physicians in this community so that more could have access to healthcare. At Panhandle Health District, again, we cover the 5 northern counties of Idaho. We have clinics in each one of our counties, and currently they're being serviced by nurse practitioners. Here in a couple of months, we actually are going to have a physician. Dr. Chase is going to see patients for us, at least here in Kootenai County, and she'll be here twice a month seeing patients. And we're looking at possibly expanding that service to others, or possibly even other MDs that might join the health district, as we try to expand our service reach in the 5 northern counties of Idaho. Moving on to the next one here is education access and quality. And is there some equity in the ability for people to be educated? The definition is simply the connection of education to health and well-being. Key issues include graduating from high school, enrollment in higher education, educational attainment in general, language and literacy, and early childhood education and development. I grabbed a couple of statistics you might find interesting. The graduation rates from high school in Kootenai County is currently at 93%. Really quite impressive here in North Idaho. Where we have some challenges, however, is that only 26% will, at least currently, will have a bachelor's degree after receiving that high school graduation certificate. So higher education would be one of those things that we would definitely want to encourage here in our community. Here at Panhandle Health District, when we talk about where we can have some impact is on the early childhood education and education in general. You know, we have our Women's, Infants, and Children program where we have thousands of mothers in the 5 northern counties and families come for nutritional education. We have our Nurse Family Partnership program where we have nurses go into the homes of new moms and provide extensive education on bonding and providing health and well-being to that newborn child. And our goal here then would be to increase educational opportunities and help children and adolescents do well in school. Pretty broad for sure. The next area is social and community context. The connection between characteristics of the context which people live, learn, work, play, and their health and well-being. Features include cohesion within a community, civic participation, discrimination in conditions in the workplace, and incarceration. Wow, that's a very, very broad definition of social and community context. As we think a little bit about that, you know, it's part of it is just civility in our community, something that in North Idaho we've struggled a little bit lately when we think of some of the political issues that are happening here. Is this a welcoming community where people can come and enjoy and have healthy associations? We know that unfortunately, when it talks about incarceration, that our jails are absolutely full and busting at the seams. Certainly a challenge for us. However, there are positive things happening here with our community as well. As a health district, we're very pleased to see what's happened in Coeur d'Alene and the trail systems in Coeur d'Alene and the beauty of that community context. I don't know how many of you, and probably most of you, have taken the time to be on the Centennial Trail that runs through Coeur d'Alene out to Higgins Point. But to be on that trail is a very, very positive event. People are happy to be there, and they'll say hi to you and encourage you as you're along that trail. So the city of Coeur d'Alene has done much to improve what happens downtown, and that is definitely helps us socially and from a community perspective. From a health district perspective, we offer many programs which strengthen the social and community context. We really appreciate the senior services that we have. We have our Fit and Fall program that has sites throughout the 5 counties where seniors come and learn healthy habits to prevent falling. And as I have attended some of those with our seniors, I realize that the greatest benefit from that is probably the social interaction that they have and the ability to speak with others. And often some of these seniors are home and alone, and they can come to this and enjoy some wonderful sociality. We also have our Senior Companion program that services our seniors that are shut-ins, where no one is coming to visit them. And we work with other seniors that become their, as we call them, their senior companions, who are simply going into the homes of these seniors and visiting them and helping them get to doctor's appointments and shopping, etc. What a wonderful program for the health and well-being of our seniors. Our goal for this particular domain is simply increase social and community support. Moving on to our next characteristic or domain, and that would be economic stability. The connection between financial resources people have, income, cost of living, and socioeconomic status, and their health. Key issues are poverty, employment, food security, and housing stability. I think all of us can look at this, and all of us probably have some level of concern in our current economy and the area in which that we live regarding stability. We all know about the housing crisis here in North Idaho. I spoke earlier about our Nurse Family Partnership Program. We currently have a young mom and a brand new baby she's living with her mother in a vehicle. And our nurses are going to that vehicle to provide support and assistance if they're not able to come to the health district for a visit. Now, I know that's an extreme example, but unfortunately, it's not horribly unusual. And housing is an issue, a place where people can live and feel that they have a home, a safe place, if you will. And that's driven by many factors we know. Part of it is income, their ability to afford a housing. I know that there are lots of concerns in this community, a lot of folks that have a no growth mentality and want to keep Idaho the way that it is. However, people continue to come here, and we have to learn to find ways to provide housing, and we are. There's some great organizations out there that are helping us to overcome this challenge. And you're seeing out on the Rathdrum Prairie, lots of building going on. And we hope that we can provide that housing stability. And also just economically, it actually is a good time, as you all know, to be employed. With unemployment rates below 3%, there seems to be plenty of jobs available. But are they jobs that are providing the sufficient income that they need? This, of course, ties to our other domain regarding education. Do our folks moving into this area or being raised in this area, are they acquiring advanced education so that they can have the jobs that truly will support their families? I heard a quote recently from a Dr. David Allen, an expert in population health, who said, you can tell the health of a family or an individual by their zip code and credit score, where they live and their ability to have the economic or the income they need to sustain their family. There is a correlation between a family's economic stability and their health, clearly. And I believe that this doctor has it right. Maybe not so much in North Idaho, but certainly in other areas of the country. Our goal here is to help people earn steady incomes that allow them to meet their health needs. And I think that wraps up this goal, or this particular domain quite well. And let's see, moving on to our last one here is a neighborhood and built environment. This is the connection between where a person lives, housing, neighborhood, and environment, and their health and well-being. This includes quality of housing, access to transportation, availability of healthy foods, air and water quality, and neighborhood crime and violence. Just a couple of things to share with you. We do live in a relatively safe environment here in North Idaho. When we can compare things like violent crime and homicides to our nation, we fall quite a bit below that, which is very, very happy to see. For example, the homicides in North Idaho is 0.7 per 100,000 compared to national that's at 5. Violent crime here in North Idaho is 81.1 per 100,000. That's someone that would experience violent crime. It's 200 in Idaho as a whole and 375 nationally. So there is some reason to feel more safe, certainly here in North Idaho, and we know that that has an effect definitely on a person's health. Some of the issues where in public health, specifically Panhandle Health District contributes or helps in this particular domain, is I talked earlier about our WIC program, where individuals and families can come in for nutritional support and vouchers to purchase healthy foods. Also in air and water quality, most people are aware, I should say, of the work Panhandle Health District does to protect our aquifer. The aquifer for over 600,000 people, the Prairie Rathdrum Aquifer is their primary source of water. And we've been measuring, the health district has been measuring, health district and other organizations have been measuring the quality of the Rathdrum Aquifer for 100 years. There has been no depreciable loss in volume in that aquifer, and also no degradation in the quality. It's one of the few aquifers that people can pull their water direct from the aquifer and drink it without filtering. This is a precious resource for the health of our community, and something that Panhandle Health District takes very seriously, as well as I think all of our community. So the specific goal associated with this domain would be to create neighborhoods and environments that promote health and safety. So with that pretty much takes care of, just get back to the beginning here, where you can kind of see how all of these fit together. And I understand that this is a broad topic, but I'm so appreciative to Kootenai Health for beginning the discussions on social determinants of health. And with that, Elizabeth or Doctor, I'm going to turn it back to you, and I look forward to hearing from Laura and Jill.
Yes, thank you so much, Don, for sharing that with us. It's so important when we're meeting with patients to understand their background, where they live, and how that interacts with their ability to participate in healthcare and receive healthcare, even picking up medications and aspects like that. So thank you so much for the summary. And I see some chatted questions coming in. We will have a Q&A at the end. Thank you for doing that. And if we can't get to all the questions at the end, we'll have a written Q&A on the website. Next up, we have Laura Bonneville joining us from Heritage Health. She's a behavioral health consultant there, and we're very thankful that she's joining us today. Thank you.
Thank you. Are we going until 1 today?
Yes.
Okay.
Yes.
I'm going to go through mine fairly quickly, just because I'm really looking forward to what Jill has to say. And I just want to give her enough time. I saw her PowerPoint this morning. I was like, oh my gosh, this is so helpful and useful to me too. And I believe that will be true for Kootenai Health staff as well. So if I speed talk a little bit, I apologize for that. Maybe just put in the chat, slow down, and Elizabeth can give me that feedback and let me notice. Pardon? Oh, can give me that feedback. So really quickly, I'm a behavioral health consultant here with Heritage Health. I've been here for about 8.5 years. And what a behavioral health consultant does is really help integrate physical health and emotional health. So oftentimes patients do come into our primary care setting or family care setting, and they want to, or they might be presenting with either a primary emotional health concern, or there's a co-occurring emotional health concern that's really impacting their physical health. And if that's the case, then a provider will choose to get me involved in care. I do some brief interventions myself in the exam room to help round out a treatment plan. But a big part of what I do is provide referral to resources in the community that can help that individual longer term with some of those emotional health needs. Today, I'm going to stay within my scope of practice. I am a mental health provider, so I'm going to try to keep this information just to speaking about mental health, including some substance use. There is so much to say about this topic, and I was whittling down until about noon today. So it may come across as a little bit disjointed, and there are some things I'm really going to expand upon just to provide some context. So I'm going to focus today on this social determinants of mental health. You heard Dawn talk about the social determinants of health, and as you can imagine, there are going to be some upstream consequences. So mental health professionals are aware that the etiologies of mental health and substance use disorders are partly driven by those social risk factors. Next, please. I'm only going to stay on this slide long enough to tell you that I like the way that World Health Organization defines social determinants of health, which are conditions in which people are born, grow, live, work, and age. And Dawn did a great job of covering the rest. So I'm going to move on to the next slide, please. I'm going to pause here and talk about the biopsychosocial model a little bit, because really this is the birthplace of talking about the social determinants of health, including mental health. So this model recognizes that the etiologies of mental illnesses and substance use disorders are partly driven by those societal risk factors. And the widespread use of the biopsychosocial model recognizes the importance of both the biological and social risk factors in shaping behavioral health disorders. So about 45 years ago, somebody named George Engel proposed a new model for medicine called the biopsychosocial model, which contrasted with the then biomedical model. So while he recognized the great advances in the biomedical model, he also argued that it was very limited and insufficient for many aspects of medical science and healthcare. And he was really concerned with the psychosocial aspects of managing illness within hospitals, and thought it could complement the biomedical approach in hospital care. He argued that it would be better to prevent illness altogether, or to detect and manage it earlier to prevent worsening, and to better provide for the community and social care where possible to avoid or shorten hospital admissions. So how is this used today? Medical providers, when doing their either their history of present illness or completing the social history, those questions include questions about education, occupation, substance use, diet and exercise, how they're completing their ADLs or activities of daily living. Mental health professionals may complete something called a diagnostic assessment, or as Medicaid calls it, a comprehensive diagnostic assessment. And this diagnostic assessment collects a lot of data from the person's childhood, along with whatever information they're presenting with. Next, please. There's a lot I want to say about this, but again, I want to eager to hear Jill's presentation, so I'm just going to talk about this briefly. Oftentimes when doing an assessment as a mental health provider, you might have a patient complete an assessment, a 10-question assessment called the ACE. And this collects information about adverse childhood experiences in 3 domains: those that experience violence, abuse, or neglect, those that have witnessed violence in the home or in the community, having a family member attempt or die by suicide, and it further collects information of things that could be happening in the environment or impacting their sense of safety, which includes substance use problems by a parent in the home, mental health problems, instability due to parental separation or divorce, somebody being in prison. And there's a question on there as well that's not in this outline that talks about the person having food in the home, or if they've ever felt hungry, or if they've ever experienced unmet needs in either food or clean clothing and things like that. So there are many other traumatic experiences that can certainly impact a person's health and well-being, but this gives us kind of a starting point. We know that individuals with an ACE score of 4 or higher are more likely to experience mental health issues and physical health issues, particularly chronic health issues like COPD. We know that an ACE score of 4 or higher means that somebody might start using tobacco at a younger age. So that's why we kind of look at that. They're linked to chronic health problems, mental illnesses, and substance use problems, both in adolescence and adulthood. Next, please. There was so much background I wanted to give you on that, and I realized that that's something that I probably should have whittled down to, so I did in the moment. The main core social determinants of mental health are racial discrimination and social exclusion, adverse early life experiences like we just discussed, poor education, unemployment and underemployment, and Dawn touched on this as well, job insecurity, poverty, income inequality, and neighborhood deprivation, poor access to sufficient healthy food, poor housing quality and housing instability, adverse features of built environment, and poor access to health care. Next, please. I'm talking about these because this really kind of expands the definition and again talks about some of those other traumas that might not be listed on the ACE. So other risk factors include inadequate or unequal access to transportation, exposure to violence, conflict, war in childhood or adulthood, mass incarceration and poor relations between law enforcement and communities, environmental air, water, or land pollution, climate change, sexism, homophobia, transphobia, and other forms of non-race-based discrimination, and adverse or unsupportive features of the workplace. Next, please. So I'm going to provide some examples of both income equality and poor education. And this next piece of information comes from NAMI, which is the National Association of Mental Illness. As of 2014, almost 14 million people lived in extremely poor neighborhoods. The worst impacted were Hispanic and African American communities. They were more than 3 to nearly 5 times likely, respectively, to live in extremely poor neighborhoods than poor whites. People living in high poverty neighborhoods exhibit worse mental health outcomes compared to people in low poverty ones. Children can experience significant mental health problems from living in these environments, as can people with serious mental illness. This determinant is connected to reduced job opportunities, increased criminal activity, and reduced quality of education in schools, which can contribute to other mental health stressors. And that's kind of that bi-directional relationship. So we've been talking so far about how the social determinants of health cause this upstream mental health and substance use issues, but also there's the having poor mental health and the bidirectional relationship or causing some of these, inadequate access to healthcare, equitable opportunities for education, income, housing. There are several initiatives that may address these challenges. One strategy is the creation of economically integrated neighborhoods. This concept can be accomplished in many ways, including the relocation of residents to less impoverished neighborhoods, increasing access to affordable housing. It's a huge problem in our area, and there was an affordable housing initiative, unfortunately, that didn't gain very much steam politically. Poor housing can result in worse mental health. Adverse conditions such as dampness, mold, and cold indoor temperatures may be associated with anxiety and depression. Lack of affordable housing may lead to homelessness, which can exacerbate mental health issues. About 40% of the homeless population have mental illness. So I want to talk about interventions a little bit. Next slide, please. So some individual interventions could include clinical interventions. This might be one-on-one psychotherapy. This might be group therapy, support groups, either in an inpatient setting or outpatient setting. And they clearly have a role for reducing mental illness, but the greatest population-based impact for preventing many chronic physical health conditions and a number of mental illnesses and substance use disorders would be achieved by optimizing public policies. And Dawn spoke a little bit about some of those public policies, but we want to promote health and maybe even shift some social norms so that we can prioritize health of all the members of our society. Health policies help shape the structure and function of our healthcare system, which has an impact on both individual and population health. And I think Jill's going to talk a little bit about some of the tools that you have available there. But I would also just mention a lot of things that we can do on our personal individual level, and that is to support things like early education interventions like Head Start. Head Start is a wonderful program at making sure that individuals that do have a lot of those social determinants of health and mental health are given more of equitable access to not just education, but they're provided with meals and a safe space for several hours of the day. So just giving some thought to how we vote, how we use our voice to support things like the expansion of Medicaid. Those are all ways in which together we can support efforts to reduce these social determinants of health. And the next slide is really just is my last slide, and it's just really a link to Jill. And she's going to be talking specifically about what some resources are and then what your tools are that are available to you at Kootenai. Thank you.
Thank you so much, Laura. That was incredible. I appreciate you. And moving to our next presenter, we have Jill Weeks with Kootenai Health, the Executive Director of Transitional Care Services.
Right. We have about 6 minutes, so I'll talk pretty fast. Hopefully, I don't think I'm going to have time to show the wonderful video, but hopefully we can send that to participants afterwards, because I think it does a really great job of really talking about the resources that are available in our community and how everyone can tap into those. So Dawn did an excellent job giving an overview of social determinants, and with Laura giving the perspective from mental health. I wanted to very briefly just highlight how it affects our patients and healthcare and why we should be aware of it and really work to support it. And then quickly show you what Kootenai has really dedicated a lot of resources to supporting our patients and also providing resources to support our community. And so just wanted to make you aware of those. This slide is from Advisory Group. It's a national consulting research organization that does best practices for healthcare improvement. And some of this data that they presented really highlights how much social determinants of health impacts healthcare. I just want to highlight a few. For those that are unemployed for more than 6 years, they have a 2 times higher death rate than other individuals. Or those that are socially isolated, which we saw a lot of during COVID, have 2 times greater risk for coronary artery disease. And then I think particularly with our extended length of stay patients, we see our fair share of patients without homes, so they're homeless or their homes are not livable or they don't have support at home. But impact on the system per capita, about a $2,400 impact based on housing and stability. And we see that with those extended length of stay patients. Next slide. And this one really is just showing that, we always think about the clinical factors that impact a person's likelihood of accessing health care, but really they're finding that almost 80% of reasons that people are accessing health care are more related to the social determinants of health that were shown. And as you think about individuals struggling with health situations and then all these other social determinants, you can begin to understand why they don't necessarily comply with their treatment plan, or they keep coming back in the ED, or why we're having such a hard time getting them placed into the community. And just this Maslow's hierarchy of need really shows that we have to help them with the very basics before we can expect them to take other initiatives to improve their health. Next slide. So Kootenai has done an amazing job building a social services network. This really just highlights the social services at Kootenai, but I know there's so many other roles and departments that support social determinants of health, like the pharmacy with 340B, that's a prescription assistance, or patient advocacy that gives gas cards and meal vouchers and those kind of things. But within transitional care services, we have social workers on the inpatient side that are supporting families and patients and assessing what their needs are and connecting them to resources. We have a team in the ED, in the crisis center, Our intensive outpatient practice is focused on supporting those with mental health and substance abuse. And then in our primary care clinics, we've implemented this integrated behavioral health model that's really supporting our patients in primary care. And then we have a team of social workers supporting the rehab center, the neurology, a lot of the specialty clinics, because we understand it's not just about the clinical factor, but there's all these other social determinants, access to housing, food, transportation, medication, that impacts their ability to improve in their health and self-manage at home. I did want to take this opportunity, it is National Case Management Week, and so just want to put a little plug in for my team, especially these last couple of years. An amazing team of professionals that are compassionate, they're resourceful, they're so creative in coming up with solutions for our very complicated patients, and I just want to give out a shout out to them because they're an amazing group of people. Next slide. In EPIC, there is a screening tool for social determinants of health. We haven't fully operationalized this yet, but I do believe that's going to be a focus for us, and not only within our department, but wherever a patient accesses care at Kootenai, we should be screening them for social determinants of health or updating that information and factoring that into their care plan. Next slide. So Kootenai invested in a database called North Idaho Connections. When I first came, and I was doing this at a hospital system where I came before, finding all the resources in the community was so difficult, and we had spreadsheets, we had drawers full of brochures, we had business cards, we had outdated information. Our community partners tried to put together brochures or booklets, and it was always outdated. And so we wanted to create something that the whole community could use to become aware of all the resources that really are available in the community and make sure that we're tapping into those and connecting patients to those resources. Next slide. So it is called North Idaho Connections. It was originally called Aunt Bertha, but they've changed their name to First Health. Kootenai has invested in a more expanded database because First Health has a national database, but it is primarily fed through a database of free and reduced services. But we wanted to know the churches that had clothing, the food banks, the support groups, people willing to deliver groceries to the elderly. And so we have a very robust database. In the video that I'll show, that we'll send you, really does a nice job of showing how important it is, how the community organizations have embraced it, and how you can tap into it or share it with your patients or friends or anybody that needs help with all of those different determinants that we talked about. Next slide. We've done a number of outreach strategies, but we have like 50,000, we got a grant for 50,000 little business cards that we've given to the police, the EMS, schools, agencies, organizations across our clinics, and as many different places in the community that we can get them out to. So if you need some and you want to have some available for your clinic or your department or whatever, we have a ton of them available. We have an amazing team member, Kathy Anderson, who is our community outreach coordinator, who manages the database and then really works to spread the word out in the community. Because if everyone's working on getting people connected to resources, whether they're here or out in the community, we'll have a healthier community overall. Next slide. And it does take a village, and so I'm proud to say that we started out with the North Idaho Connections, and I presented at a caregiver conference, and the Idaho Department of Health and Welfare was so impressed with what we've done at Kootenai that they got a grant and were able to expand First Health across the entire state. Their database isn't as robust as ours, but it's a statewide database now that everyone can access We're involved in regular monthly meetings about how we can optimize this tool and spread the word. And so I think Kootenai should feel really proud about being a front leader and identifying the need for a resource like that, and then really being a partner across the state so that not just North Idaho, but all Idahoans have access to these resources and can find the resources that can help them. Next slide. Some future opportunities, as I mentioned, I think an expanded standard screening across all of Kootenai is an important next step that we need to put in place. We've also talked with United Way and other partners about a regional steering committee so we can identify those gaps and really get creative about filling those gaps. Linda Henrik has done an amazing job with this What Matters conversations, but I think as we're building out and working with patient and family on their care plan, that we need to find out what's important to them, because living in an RV with no running water out in the woods might not be something that I would necessarily want to do, but it's their home, and so we need to meet them where they're at and provide them with as many resources to support them where they're at. And then community health workers and technology are a couple of other strategies that have been out there that I've worked with that can also help support our community and our patients. And that's it. Thank you.
Thank you. That was impressive. So thank you to all of our presenters. That was a fabulous summary. I wish we had another hour to talk about it. So thank you, Laura, Dawn, and Jill, and we'll have the recording up on the website here probably within the next 24 hours or so. Moving ahead to next month, we have our Inclusive Care Book Club, and the book that we've chosen this month is The Spirit Catches You and You Fall Down, which is a phenomenal book. There are copies available at the library and on Kindle and also on Audible. And so hopefully we can see a good attendance at that book club as well. Please join us next month. So thank you, everybody.
Thank you. Have a great day. Bye-bye.